August 12th last year, I returned to Oslo, having spent 3 months working with Doctors Without Borders in the world's largest refugee camp in Cox's Bazar in Bangladesh. I was exhausted, mentally and physically. I was extremely angry, frustrated, and sad. Having had my view of the world and humanity forcibly shaken, I didn't have the strength to face anyone. The first week after I returned home, I stayed in bed. I was relieved to be back, but somehow I also felt ashamed. I had the privilege to leave, quit, and get back to the best summer Norway had ever seen. Not only could the people I left behind not leave, they had no notion of what the future might bring. Not then, and not today, 2 years after they fled. Many of you might have read the stories of what went on in the fall of 2017. After years of suppression, violent clashes broke out, forcing most of the Rohingya community to flee their homes in Myanmar and seek shelter elsewhere. In a few months, more than 700,000 fled across the border to Bangladesh. The majority of the Rohingya were stateless in Myanmar, which is why they're not recognized as refugees. What does it mean to be stateless? Well, it limits your access to healthcare, and you cannot move freely outside of a camp. Your children are not entitled to an education, and you as an adult cannot take a paid job. I'm a medical doctor, and I've worked for 10 years now, mainly at hospitals in Norway, clean and free of charge, with 24-hour access to the best healthcare any government can provide. As many healthcare professionals, I had a long-standing dream of joining Doctors Without Borders, an independent medical humanitarian aid organization that provides free, high-quality healthcare where this is not available, be it due to conflicts, natural disasters, or lack of resources. I've worked with Doctors Without Borders before, but nothing could have prepared me for this project. The amount of people living on top of each other, often a dozen family members living in a tiny bamboo shelter. The quality of hygiene and sanitation services was dire at best, completely lacking at the worst. And the vast majority of the diseases we saw were a direct result of the living conditions. Being in the refugee camps in Bangladesh hit me hard. I had seen the pictures before I left. I thought I knew what I was getting into. But what you see standing on top of a hill in the camp, a 360-degree view of iron sheet rooftops, it's not something a picture can capture. There was no end to this camp, and where it ended, another one began. The 2 camps I worked in hosted 180,000 of the nearly 1 million Rohingyas that had fled. We had a clinic in each of these camps, and my job was to oversee the medical activities. On average, we saw 600 patients a day. The line of people in need of basic health care was never ending. Our patients presented with a variety of complaints, and through their stories, I got a small peek into what obstacles they had overcome. Lifting the shirt of a patient could reveal scars so deep, they told their own story. I saw families going through unimaginable suffering. I never asked them their story. I knew I couldn't bear to hear it. Early one morning, I got a call from my colleague. I knew that in order to get a phone signal, he had had to leave the patient and the clinic behind and run to a bridge 5 minutes away. It was always important when they called at night. Dr. Hassan was slightly out of breath as he started reporting. Some bypassers had heard a child's cry from a latrine. They broke the latrine and found an infant laying in the septic tank. Covered in human waste and insects, they had carried the newborn to our clinic. His umbilical cord was still long and intact, torn at the end. His body temperature was dangerously low. Dr. Hassan had made sure they had cleaned the child. Now he was asking me what his next step should be. His next step? How would I know? I normally work with adults, and given access to a properly equipped intensive care unit, I know exactly how to safely increase the temperature of an adult. A newborn in this context? Reheating an adult means major danger for brain and other organ injuries. This child had already survived the worst potential start to life. The kangaroo method is a safe bet in many situations. The man that had brought in the child took off his shirt and shared some of his warmth with this child by putting him to his chest. They were both transported this way to a better equipped facility some hours away. The child survived. No apparent damage. He started his life proving that medical and humanitarian miracles do happen. This incident stuck with me and is one of the stories I've found the most difficult to share. How could I make others understand the many aspects of this story? The girl with an unwanted pregnancy, maybe with her own traumatizing story of how it came to be. Would people see that she's not a bad person? That this might be linked to generations being prosecuted, stripped of dignity and freedom of speech? That this was, for her, the only possible solution in a desperate situation? Faced with this case, I was not shocked by the brutality of the underlying tragedy. I was stressed about what antibiotics to give, how to safely increase the child's temperature, the mere basics of medicine. I was worried I was not competent enough. The possibility of this child surviving that latrine just to die because he didn't get the right doctor. I was concerned about the mother and the injuries she might have sustained during delivery. And I was petrified at the thought of how my colleagues from the medical world would have judged my actions if things hadn't gone well. The fear of making mistakes is a never-present concern for any doctor, and many of the medical challenges I face in the field are far away from my pool of expertise. Before going for missions, we are briefed on how to manage emotional stress. I never took the time. You pay the price for that when you return home. I have felt that the cost of being a humanitarian is that I've become a worse friend, daughter, and sister, with less interest in people's everyday problems. Many of us will, through the years, have experiences that may be dramatic. And if we manage to put what we learn from them into the way we deal with day-to-day drama, the experience might evolve into something useful. I'm still working on that. And lesson learned, next time, I will write a diary, cry my tears out, exercise, and bring lots of chocolate. Stress management might give you peace of mind from what's happening around you. At times, I could see myself from the outside, standing in the middle of an emergency that was slowly turning into a chronic crisis. I saw aid organizations starting to close or scale down their operations, and I felt like screaming, "Don't leave!" The response of aid organizations can often be short-term in scope, treating the symptoms without having the power to deal with the causes of it. As time passes, media and donor countries start losing interest, and funding for humanitarian response remains grossly inadequate. In addition to giving medical care, bearing witness remains a central reason for Doctors Without Borders' continued presence. In the year 2000, when estimated that between 25 and 40 million people had been displaced from their homes. In 2019, 71 million. Rapid climate changes and political games are forcing people to flee, and we need to find more effective solutions to help those in such precarious situations. We talk about helping them where they are. That's a great idea, but how do we accomplish this? How can we, as individuals, help a young man on the other side of the world? Individuals that have survived torture and persecution develop a capacity to deal with any crisis and can be a huge resource to a community. That is, given that the invisible trauma they have suffered is addressed. The emotional sufferings of refugees must be taken into account. This is the only chance a community has to collectively be strong enough to rise to the challenge. Aid dependency is not sustainable and can to some degree be prevented by including the beneficiaries in the work. We do this by training them in methods to help and support themselves to deal with the consequences of instability put upon them. Something we all can do is donate money to non-governmental organizations that we trust and value the work of. Being aware that as an individual, you are right to be critical to the way the organization is spending its budget and to know how your donations are being used. Humanitarianism is by its definition impartial, neutral, and independent. Our presence relies on being accepted by all sides in a conflict. This is the same reason why we cannot accept fundings to treat patients from the same states responsible for their situation. But there is more to it. Situations like the one the Rohingyas are in require international political action. We decide who our politicians are, and we have the collective power to call for their attention. Read, write, share, and discuss. Put pressure on governing actors. We can also work together to push for better access to medicine and vaccines. We saw many cases of pneumonia in the camps, a disease for which there is an efficient vaccine. But because pharmaceutical companies put the prices so high, almost a third of the world's countries cannot afford it. A few years back, public engagement from almost 500,000 individuals made those companies reduce their prices for humanitarian organizations. We now have to work to push them further so that all states can afford the vaccine and protect their children against a disease that kills 900,000 a year. We have access to a fantastic tool, the internet. Use it to do your own research on what is happening in countries the media is not writing about. Be critical of your sources. Share the good sources you find and be part of mobilizing that engagement that we know can create change. We know it works. Campaigning remains an important tool in combating diseases that further destabilize weak and impoverished societies. It's not easy to get engaged reading a feature article about something happening far, far away through the filter of a screen. It can be overwhelming and feel like the battle is already lost. Not everyone can or should travel across the globe to help directly, but support those who do. Find your own way of showing your compassion with those in desperation. The aim is not to lower the standard of care we receive in high-income countries, but to work towards making it available for everyone. All people should have access to medical care. I love the work I do, but my dream is that the need for at least medical humanitarian aid organizations will one day vanish. I'm still hopeful. I have a ridiculously high belief in humanity and what we can achieve once we decide to. A person must be healthy, feel respected and protected by the law in order to maintain a minimum of life standard. The best way we can contribute to that is by raising awareness and stop accepting injustice. Silence can kill and is killing neglected minorities as we speak. The gaze of the world is shifting towards other humanitarian crises that also deserve our attention. My plea is, don't forget the situation of those who have fled their homes. Somewhere, there's an orphan child of 15 months and 28 days that started his life in a septic tank. Talk about him and raise your children to grow up to be willing to hold a child like him to their chest.